Go.
Hi, I'm Emily Thayer. I'm a physical therapist assistant.
And I'm Ryan Downs, and I'm also a physical therapist assistant here with Southern Indiana Orthopedics.
Today we're going to show you how to progress a total knee replacement. So this is my patient. He's going to sit up here on the table. You're going to pretend it's his left knee. Some things you need to know about first is there's no restrictions with total knee. Your goal is to get to 90 degrees knee flexion, which is the bending of the knee, by 2 weeks. And we want it to be as straight as you can, trying to touch the back of the table by the first 2 weeks as well. So some of the first exercises we'd like to do are some ankle pumps. You can set a towel roll underneath the ankle. This will help with swelling, just kind of going up and down. Usually do about 20 reps of these as many times a day. Another exercise we like to start with is, I'll put this underneath the knee. You're going to try to activate the quad, squeeze the quad and push your knee down into the table. You'll do 20 of those, hold for about 5 seconds. Then relax, push down. Once that starts getting easier, you can take the towel away and try to do the same thing. Again, this will be working on straightening the knee. Okay? Another thing to promote knee flexion would be putting a towel underneath your leg, using a strap, belt, whatever it is, around your foot. You're going to use your hands to pull the knee up and try to bend and stretch as much as you can. Try to do that 20 times and hold for about 5 seconds as well. One more time. Perfect. Okay. Another thing to work on the knee straightening, you can fold up a towel and put it underneath the ankle. And all you do here is just relax. Let the gravity work its magic and let the knee hang, and you're gonna just let that relax 3 to 5 minutes if you can. Start with 1 and kind of bump it up just as much as you can. Just let it sit there, stretch that knee. Okay. Another thing, I'm gonna have you sit on the edge of the bed. It's his left knee, so what I'm gonna have him do is put his right ankle over top of his left ankle, and then he's gonna push back with his right, trying to bend that knee as far back as he can. Again, 20 times, hold for about 5 seconds. Perfect. Okay, and then working on straightening. He's going to put this underneath and help straighten it out as far as he can. So the right one's kind of doing all the work here, helping straighten. You're still firing this quad to help out, but the right one's the one helping. 20, hold for 5 again. All right. I'm gonna have him sit in the chair next. And what we're gonna do is just a seated hamstring stretch. So he's gonna sit on the edge of the chair. He's gonna prop that leg out, toe pointed up, and he's just gonna relax that leg there, working on the straightening here again. He can bend forward to get more of a stretch. We usually do 3 of these, hold it for about 30 seconds. And you can relax and bring the knee up if you need. Then you'll straighten it back out and do it again. And the last one that we try to do for knee bending would be trying to pull that knee back underneath the chair as far as you can. You can do it yourself. Once you get to a point where you can't anymore, you can use your right leg to help push it back as well. Again, trying to get to that 90 degrees within the first 2 weeks. Perfect. All right, we're gonna come back up to the table. So within the first 2-3 weeks, we're gonna start doing some strengthening stuff. So I'm gonna have him sit on back here with both knees bent up. We're gonna focus on all the muscles that are around the knee and help stabilize the knee. We're gonna go below the knee and above. So right now we're gonna work on hip. We're gonna put a ball, you can roll a pillow up and put it in between your knees. What he's gonna do is he's going to squeeze the ball 20 times, hold it for 5 seconds, working on the inner thigh muscles here. Perfect. All right, next one I'm gonna lay him down. He's gonna try to bend his knees up. And what he'll do is squeeze his glutes and lift his bottom up off the table as far as you can go. Right there's perfect. And then control it down, working on hamstring and glutes. About 20 of those. Perfect. All right, now to work on the side muscle of the hip, we're gonna lay on your right side. So your injured leg will be on top. The bottom leg will be bent. And what you're gonna do, just gonna lift that leg up in the air. So we're right there and back down, working on the glute med. We're gonna do 20 of those, hold it for 5 seconds. Perfect. All right, another one, you'll lay on your back again. Gonna work on the quad. You're gonna have that knee bent up. You're gonna squeeze that quad, push down in the table just like you're doing the quad set. You're gonna try to raise your leg just to right here, a little bit lower than your right leg bent up, and then control it down. You don't have to hold this one, just nice and easy, up and down. Shooting for 20, as much as you can. Down, perfect.